Hi there! I wanted to teach you guys today a little bit about jaw pain and what you can do from home to reduce and eliminate your jaw pain. So a lot of us might think that a little jaw achiness or some clicking or cracking in your jaw might be normal, but it's actually not, and we want to minimize that as much as possible. So here are some things that you can do to help yourself from home. First of all, I would recommend doing some gentle self-massage for your jaw. So there's a few muscles that you can work on. First of all, we're going to work on this bigger muscle here that runs through the jaw. And now if you bite down and clench, you'll be able to feel that muscle engage. It's one of the bigger ones that helps us chew. So you're just going to do a really gentle self-massage. You're just going to do little circles on that sore, tight muscle. You might even press and hold if that feels good. Remember to be gentle. We don't want to be too aggressive with our bodies. So you're going to spend 30 seconds or a minute on each side, massaging that tight muscle. Once you're done, you're then going to work on a smaller muscle that's right in front of the ear, right where the jaw, where the joint actually is. So if you find that little groove, you'll find a bone, and underneath it is the groove. You're going to be massaging kind of in that groove. And it is a small muscle, so you might not feel it, but it might feel tender, it might feel sore, like it needs a bit of a massage. So same thing, 30 seconds to a minute, and the same on the other side. You can also massage these muscles up here in your temples. So that comes all the way up and helps you clench your jaw as well. So you can do in the temples, anywhere that feels good, in little circles or press and hold. And lastly, the last place that you're going to massage is actually underneath. So there's a tiny little muscle that goes underneath, below the ear, around the jaw, and then under towards the chin. It is small, so you can gently massage in there, and I find the best way to do this is actually to lay down. So I'll show you that in a minute. Just keep in mind when you're massaging in here, there's lots of blood vessels, there's lots of glands. It's a really delicate, sensitive area, so always be nice and gentle, especially in this area underneath the jaw. So the way that you're going to do that laying down is you're going to lay on your back, and you're going to use the opposite hand. So if you are massaging the right side of your jaw, you're going to take your left hand and you're going to reach up and over so that your fingertips are just going to gently sink in that area underneath the jaw. And you're just going to sink in and massage, and you can even slightly stretch one way or the other with your hand. And then don't forget that muscle is here underneath the ear as well, so you can get into that part of the muscle as well. And of course, do the other side, so opposite hand reaches up and over, and then gently sink in with the fingertips. So you would spend, just like everything else, 30 seconds to a minute at that spot underneath. And now I want to teach you about the resting mouth, which is what I call the posture that your mouth should be in. So we shouldn't be clenching all day. That's just going to lead to more pain, more soreness, more clicking. We actually want our mouth to be resting so that it has minimal effort and minimal muscle engagement while you're resting. So what you're going to do is, first of all, your molars should be slightly separated. We don't want them to be touching because that means that you're clenching. So molars slightly separated, and then your tongue should be resting at the roof of your mouth, so that your tongue is relaxed and wide. And one edge of your tongue should touch the molars on one side, and the other edge of your tongue should touch the other molars. And that's that resting mouth position. So in order to do that, that means that your mouth is closed and that you're breathing in and breathing out through your nose. So that allows those muscles to relax. So the only thing that's keeping your mouth closed is actually the pressure that's created inside of your mouth, instead of the muscles having to clench to keep your mouth closed. So what I would recommend you do is massage all of those various spots and then go into this resting mouth position and try to hold that throughout the rest of the day. And inevitably, just like posture, you're going to notice that you're not doing it correctly anymore. You might notice that you're clenching. And if you notice yourself clenching, just give yourself a short little massage again, wherever you feel you need it, and go back into that resting mouth position. And slowly over time, you're going to get used to this and you're going to stop clenching so much, which is going to relieve that muscle tension and the pain in your jaw. Another thing to keep in mind is if the jaw is out of alignment, it's very likely that the bones of the skull might have restrictions in them, might not be sitting properly, moving properly. Most of us think of our skull like a big old bowling ball, but it's actually not. It's a bunch of puzzle pieces that fit together. And if there's tension through the skull, it can pull those puzzle pieces slightly out of alignment, creating tension in one and a chain reaction that can affect your jaw. So in order to work on that, there's a lot of gentle, light touch releases that your therapist can do to work through your skull and to work on your jaw. So if you're feeling any of those things, speak with one of our therapists. We can always schedule you an appointment and to do some hands-on work through the skull and through the jaw in order to help you as well. So I hope that those things are able to help you in the meantime from home to help you feel a little bit better. And as always, if you have any questions at all, reach out to us, send us an email or a request through our website, and we'd be happy to help you with anything that's going on. Have a great day.